Doc, it's been a couple years since I've had Intacs placed in my eyes, and then I had advanced laser surgery with you. That's been 2 or 3 years. Are there new developments since then to make it even better?
Yes, Willem, absolutely. If you remember, in your case, you had Intacs done with another surgeon, I think up north, and when you came in, you weren't happy with the vision, and we decided to do a laser in addition over your Intacs rather than just a knee-jerk reaction of removing your Intacs. And these concepts are what I've been constantly teaching eye surgeons all over the world, that keratoconus has so many ways of being approached because each case is so individual. And even cases who had previous surgery like Lamellar Keratoplasty or Intacs can further be enhanced with laser on top of it. My philosophy being, since the doctor has already done the Intacs, in a way he's done us a great favor. He's put braces into your thin, unstable cornea and made it a little more fertile ground for us to shape it up, and then you can see better. And you've shown consistency over the 3 years follow-up that I've done with you. Future developments are Collagen Cross Linking, where we'll be able to shape the cornea with the laser in a keratoconus patient and then cross-link the collagen so it stays permanent in that situation. So that's a great development because you do know I do laser on early keratoconus to help them see, and this will be a great way of if you may, permanentizing that procedure on their eye and their cone doesn't progress anymore. And that's great if you catch it in young people, if you think about it. So keratoconus has so many avenues to treat, and I break it down into simple concepts. You can do a laser in early cases. You can do Intacs, which also has 7, 8, 12 ways of doing Intacs: single ring, 2 rings, paired rings, thicknesses, different sizes of the rings itself. Then laser on an Intac, like you. Then you can go inside the eye, put a phakic implant like Vision ICL. You can even do cataract surgery with specific lenses like toric lenses, and combine all of this with laser. You can do transplants and combine that with laser. So keratoconus today has so many avenues that, at least I believe, every case of keratoconus has a procedure choice today, which can give them some level of freedom to see the world again.
Well, I'm excited, Since you've been my doctor, I know my vision is a whole lot better, and I appreciate it. And I'll keep coming as long as I can.
Been a pleasure, Lynn. Again, enjoy the profession you're in. It's an honor for me.
Yes, sir. I appreciate it. Hey, I was diagnosed with keratoconus. Being nervous, didn't know what that mean. Figured out what it mean. Did a little research myself. That it's a degenerative disease. However, once I met Dr. Gulani, I knew even though it's just degenerative, there are things that can be done. As a young guy, I was thinking, man, I shouldn't be losing my vision at this age. But after speaking with Dr. Gulani, having my advanced laser surgery, and seeing that there is hope and my vision has changed, and I would encourage anybody that has the same condition, keratoconus, do your research. You only have two eyes, but you want the best person working on your eyes because you don't get a second chance with your eyes. Dr. Gulani, I would recommend for anybody because he's been great for me.